But the way to think about the digestive system as a whole is 420, yeah, page 424, 423. That's where it's at, towards the back. We're getting through this book. You've gotten through a lot of it. So the way they kind of break it up is digestive tract and the other accessory organs. That's the digestive system. So basically, if you look at that first picture on page 423, where it's talking with the first page of digestive. Oops. Sorry, I'm making sure some stuff is recording my audio in this time. So borrowed some audio equipment from the church, so I can do that. All right. It's penance for the 10 years I've given them without doing all the hard work I've done for them without getting paid. I borrow stuff when I want, so because we have a lot of it. So anyway, so digestive system, basically how the book labels is, you have your digestive tract, you have accessory organs. What does that really mean? Well, digestive tract, that T-R-A-C-T, tract is just saying this is where food goes. Kind of like the respiratory tract is where air goes and it doesn't go anywhere else. Our digestive system has a tract, a tunnel system, a system where food only touches that and it doesn't touch anything else. We do have some accessory organs. That's how I look at it. So the book labels things like our teeth, our tongue, salivary glands. Now food is going to kind of touch those. So that kind of puts a hole in my thread. But what I mainly look at the accessory organs is not so much those guys as I do the liver, pancreas, and gallbladder down there, okay? But how they're distinguishing is basically we have a tract of systems where food is going to flow, and then we have things that we call accessory organs that assist in this, but they're not directly absorbing the nutrients, basically is how the book is saying it. So like your teeth, your saliva, your tongue is getting particles from your food you eat and telling you about taste for those gustatory cells, but it's not benefiting like your tongue. Does that make sense? Like your tongue doesn't get any nutritional value from what you eat. It just tells you what it tastes like. Your teeth help you break up the food, but they don't get any nutritional molecules or value from the food you eat. That has to go through the stomach and get absorbed. So what the tract is talking about is the tract is where food touches and where we actually are going to absorb nutrients. And that really is kind of talking about all the way the tubes that we have, the mouth in general, the pharynx, the esophagus, the stomach, the intestines. But what the tract is saying is that when I eat food, it's got one path. It's going to start in the mouth. It's going to work its way through this tract all the way to the other end and end up in the toilet. That's the path of food. Accessory organs are just there to assist along the way. Food doesn't really directly give them any nutrients, okay? So the big three that I always look at as accessory organs are mainly down at the bottom: liver, pancreas, gallbladder, okay? So liver, pancreas, and gallbladder, food doesn't really go to them, but they're right next to our digestive system. They play a huge role in helping us digest stuff. And they're tucked in on Terry here, but we can kind of get him in the middle. So we'll kind of go through it. How the book kind of labels it first is mainly just talking about going kind of from the general structure of our anatomy of our whole abdominal cavity, and then it goes through the tract, and then takes a stop off to talk about the main important accessory organs. So I look at it like the big three. Accessory, like accessorize, right, ladies? No? I don't know. That was like I feel like that was a 90s term, wasn't it? Accessorize? Maybe that's still a fashion thing. I don't know. But like things that accessorize the outfit. You got the outfit, but you got things that help make it look like that. You can get away without having earrings, but earrings make it look prettier, whatever. So for our digestive system, our accessory organs are things that are helpful, but aren't getting any nutritional value from them. The tract is where all the nutrition and is all goal is about it breaking down the food. Everything else is just helping do that. So if you flip over and kind of look at page 424, where I'll first talk about is the body of work. And I kind of revised these slides, and I've got to update the slides on D2L. I'm slow, but this was 423, 424. This is literally, I revised some of these slides last night, so I got to update it still. But The body of work section on page 424 talks about digestion. All I want you to think of for digestion is that word digestion just means break down of food. That's all we're really talking about. Break food down. Keep it nice and simple and sweet. The goal of digestion, what digestion is, the definition of it, break food down. What are we breaking food down into? Components or molecules we can use. Does anyone remember? I mentioned it, but basically everything we eat, everything in the world, we can break down into three things. So remember what they are, three things. Proteins, fats, sugar, yeah, carbs, sugar. The basic structure of sugar is called carbohydrate, so it's basically carbs, which is sugars, fats, proteins. So the goal of digestion is to break things down into those three components so that we can use them, okay? That's all digestion is. That body of work just talks about, hey, you can talk about it in two ways, mechanical digestion and chemical digestion. So it's worth noting that body of work, and it's neat to know, okay, the difference between these two, how we highlight them. There's areas of our body that kind of do both these things. There's areas that focus on one or the other. But the whole role of the digestive system is in the name, to digest food, to use it, to break it down those three things and utilize it. So mechanical, this is where we talk about crunching food up or churning or compressing food to keep breaking it down. Well, where do you think mechanical digestion starts? In your mouth, right? What do? You chew the food, right? Not all food is like Jell-O. You can't just swallow it. You got to break it down a little bit first before you can even get it. So mechanical digestion starts in the mouth. That means that digestion starts in the mouth. So that could be a test question. I give you that hint right now. Where does digestion start? It starts in your mouth. As soon as food hits your mouth, digestion is starting because, one, you had to chew it. And that's a form of mechanical digestion because all digestion is breaking food down. I'm not talking about our body absorbing the nutrients. I'm talking about taking I don't know, name your favorite food. Anybody? Who? Tacos. Steak. No pizza? Pizza's the bomb. Taco, steak, pizza, that's all good. All right, whatever it is, tacos, when you eat that taco, what do you have to first do with it? You got to put it in your mouth and chew it. That is the first form of digestion as mechanical. First phase, it's first thing. So as soon as food hits your mouth, you're already breaking it down. You're breaking it in smaller pieces so you can easily swallow it, but that's mechanical. Also, technically, our stomach and some of our other areas, when we talk about the stomach does actually a form of mechanical digestion. Because when we look at the stomach is a very muscular sac, basically. We'll look at the stomach in a little bit, but the stomach has three layers of different muscles that try to compress and like churn food. You know, like the old churning butter thing, okay? Like churn it around, like mix food up, and that breaks it down even further. That's a form of mechanical digestion. So what do you think about chemical digestion? If mechanical is like chomping like our food up and breaking it down and our stomach churning it, what's chemical mean probably then? Breaking it down with some kind of chemical, right? That's straightforward. This means that we have dedicated throughout our system, and we're going to learn a lot of these. We have enzymes. Enzymes are just a molecule or a material. Enzymes are a lot like hormones, but enzymes' job is to break down food as well, chemically break it down, okay? So, has anyone probably had a popsicle or a lollipop in here? I'm sure they have, right? Okay. Now, how in the world, you remember the old commercials with the owl and the, what brand lollipop is that? How many licks is it? Tootsie Roll, Tootsie Pops, right? How many licks does it take to get to the center of a Tootsie Pop? You remember those things, right? Well, here you go. Here's why licking a Tootsie Pop is still a form of chemical digestion, because guess what's in our saliva? An enzyme that helps break food down. So that means that's how we could eat some stuff like that, like a Tootsie Pop or whatever, without really biting it, is you could theoretically do that with a lot of stuff. We make candies and stuff that you can suck on that eventually will dissolve, right? Lifesavers or mints, they're going to eventually dissolve because there's a chemical enzyme in your saliva that starts breaking food down. So Digestion starts both chemically and mechanically in your mouth. As soon as it hits the mouth, we start it. There's a lot, pretty much the rest of the way, starting in the stomach, all the way to the small intestine. Pretty much starting in the mouth, we have a bunch of chemicals that's job is just, these enzymes are designed to break down one of these three components of food. Maybe they're targeting fats, maybe they're targeting sugars, maybe they're targeting proteins, but overall, they're trying to break it down. So we do both as soon as we hit the mouth, okay? That's the big take home, is that digestion starts in the mouth, and that's in the form of mechanical and chemical by chewing and saliva in the mouth, and we'll talk more about the mouth anyway. But I just want you to hear that what digestion is. Digestion is just breaking food down into those three components. So, tissue layers is talked about on 424. We've talked about layers of every organ system we've talked about so far. Digestive system, no different. Instead of the traditional, though, a lot of our stuff has had three, right? Like 3 layers of the blood vessel, 3 layers of the heart. Our digestive tract, that includes like the esophagus and our intestines, have 4. They have 4. So from the inside out, it goes mucosa, like mucosa, submucosa, muscularis, serosa. So I'm going from inside out. There's your 4 layers. They all play a role. So the mucosa is on the inside. Mucosa on the very inside layer. This layer's got the cells that do a lot of the absorbing. Cells that have cilia, we're going to talk about that more. Also has mucus too. Because what do you think? Why do you think we have mucous membranes everywhere? Our intestinal lining, this mucosa, classifies as a mucous membrane. But why are we producing mucus all the time? We're gross people. We got mucus everywhere. Well, again, it's kind of like the point of mucus in general is about catching things, slowing stuff down sometimes, also letting stuff like slide basically too. So your intestines never get like dried out. Not just when they don't have food passing through them, there's still some kind of liquid there. It's like a really, really gross example of a water slide, I suppose, but that's the goal. Kind of keep everything lubricated and moving. Submucosa, layer underneath that's the layer, if you look in the book, submucosa is the layer that contains a lot of the blood vessels, lymphatic vessels, nerve endings, some of the glands, that sort of stuff. So submucosa is the layer underneath. Again, if I'm talking from inside out, from inside the intestines, outside, again, inside the esophagus, this is the same pretty much as soon as you get past the mouth, every layer in the digestive tract is going to have these layers. And then muscularis is that kind of middle / third layer from the inside. What do you think muscularis is? I heard someone start to say it. It's muscle, right? More importantly, smooth muscle, right? Which we know is involuntary. We don't have control over it, which is a good thing. Could you imagine if you had to sit here and think about, right, moving your intestines all day? You'd have no brain capacity to do anything else. So the muscularis layer is layers of smooth muscle. Why am I stuttering so much today? Blah, 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 blah. The muscularis is technically 2 layers, but that's not a stressor. It's just layers of muscle that are trying to move. We're going to talk about intestinal movement, but our whole digestive system has some movement to it. It's all about moving food, or what's left of food, down the path, okay? And so we need a pretty strong muscular system, and the muscularis is a nice layer in our intestines. So our intestines are always moving, and we'll talk about what some of that movement is called later. And then on the outside, all of our organ system has some kind of outside membrane layer. This one is called the serosa. So the outermost layer, it's just a covering. It just covers our intestines. So this is similar for the esophagus, similar for the stomach, similar for all of our intestines, our large intestine, all the way down to the colon, rectum, kind of all these areas of the digestive tract are going to have these layers. It does mention something there. I'll mention a side note. On this picture, it talks about something called the enteric nervous system, and it mentions it also the body of work on the next page, 425. I left a slide in here about it. I'm not testing you anything about the enteric nervous system. I will not ask you any test questions, full disclosure, but if you want to hear about it, the book makes a big point with it, and some people talk about it. It's basically that if you look at our nervous system, statistically, it has almost as many neurons as our brain and spinal cord combined, which is interesting. So there's a lot of nervous system influence, and they talk about there's a lot of nervous system influence with our stomach and our brain, and this is why over the last few years you probably heard a lot of big promotion about gut health and stuff like that. So like having a healthy gut is kind of good for your overall body's health, and it is because of the relationship that our brain and our whole nervous system has with this nerve endings all over our stomach. But it's kind of the only place that we have this established two-way sensory and motor connection that's constant connection between the two. So it's interesting, but there's not really anything scientifically that I can think of that's going to stress you out as a nurse that this is something you need to know. I think it's a nice to know, but it's borderlines with the nuts to know because there's not really a direct relationship between this and that. There's not a direct relationship between medicines necessarily in this because most medicines are absorbed in blood from the digestive tract and then carried somewhere, so they don't have direct nervous system impulse. But it is a nice to know because you can see why when people, vice versa, people have issues with their brain, like a brain tumor, or issues with their nervous system. Sometimes it can affect their gut health. It affects their ability to digest food properly and some stuff like that, and vice versa. So there is a relationship there that's odd and unique, but I'm not going to test you over it because I think it's just not a practical thing. It's an interesting concept. Page 425 talks about what covers our digestive tract. So we have, digestive tract is unique as a whole, the whole digestive system here, everything in our abdominal cavity. So that's the cavity below our thoracic cavity, right? Everything in our abdominal cavity is a little bit weird and unique as far as how it does its outside layer. So we talked about the layers of digestive tract. Well, remember that everything we've talked about so far, right? Heart, lungs, so pleura, right? Pericardium, they all have some kind of sac around them, right? That's been established. Our digestive system is no different, but pretty much remember, right? We saw the initial picture, and you can see it on torso tear. The digestive system is pretty much the whole abdominal cavity. There's so many different organs, and we have feet of intestines. We'll talk about that. We have several feet of intestines. So how do I membrane all that efficiently? Well, again, our body is all about efficiency and not wasting time or space. And so our body does a little weird thing. We have this membrane that lines our abdominal cavity, the whole abdominal cavity, and the abdominal organs together, called the peritoneum. That's what that's called. So peritoneum is the membrane, like our heart's pericardium, like the lungs' pleura. It's a membrane. But it's unique because it kind of surrounds the whole abdominal cavity and it wraps around individual parts of our digestive system because that's what's all in this abdominal cavity. So it takes a little bit of more exposition. It's not just standard straightforward. It's a little bit weird. So there's some terms to kind of hint on here. So the word peritoneum is the name for the lining of the whole abdominal cavity. So peritoneum would be kind of this whole thing, lining everything in the abdominal cavity, okay? There's not really a line there, so I can't really do that. So that's your peritoneum. Okay? But because it has to wrap around our intestines that are all folded up, it has to wrap around our other digestive organs, it technically has something else, basically, some other structure off of that, just to confuse us, not really, but has another name. It's in bold there. It's called mesenteries. Do you guys see that? So basically, layers of visceral peritoneum called mesenteries. So remember that all of these, like the peritoneum, like the pericardium, these are all double-walled sacs. So I introduced it a little bit with you with the pleura of the lungs, that there is a Typically, there's a visceral side, this double-walled membrane. There's a visceral side, meaning a side that's attached to actually organs. Then there's usually a parietal side, a side that's attached to abdominal wall, in this case, attached to the thoracic wall for the lungs and the pleura. So there's kind of a two-sided double layer, and one's visceral, meaning it's wrapped around the organs. The other is parietal, meaning it's attached to the wall or something like that. And so we have this branch off of the visceral layer of the peritoneum they call mesenteries, which is all this. So mesenteries is just what they're talking about, these branches. So you can see that off of this peritoneum, there's branches of this membrane that come off, and they wrap around individual organs. So what they're showing us here, this is a, right, probably the spine's in it, so it's probably a mid. You remember that? Do you remember this at all? Mid what? Remember this cross section? Mid-sagittal plane, right? Because we cut them in half, we can see their spine, so it's probably mid-sagittal. But this mid-sagittal plane is showing us these mesenteries. So what I'm kind of coloring in yellow, that's the mesenteries. These branches of the visceral peritoneum that branch off and they wrap around individual organs, and they kind of keep everything in place, okay? So, right, our intestines are wedged and jumbled up in here, but we have pieces of our intestines that are actually attached to our abdominal cavity so they don't go flopping around, okay? So it's a little bit interesting. A combination of, this is going to sound weird, but a combination of, you know, the feeling you get when you're on a roller coaster or something. You go over a hill and it does the gut feeling. That's a little bit to do with balance, but it actually is a little bit of your intestines and everything kind of moving. There's some play in here. It's a little bit of a safety thing, but there's some play and movement in our stomach and our intestines. They're able to kind of move up and down. During surgery, they can pull a large amount of intestines out of the way and actually take physical intestines out of the body and like set them on a table next to you, okay? They could do that because only parts of it are attached to the mesenteries. But that's what mesenteries are, is just to kind of hold it in place. If all of it was loose, you could see where that might become a problem. If there are no attachment points, well then everything could get jumbled up all kinds of ways. Intestines could twist easy, that sort of stuff. So these are trying to hold them in place. And there's a thing I want to mention. So out of the talking about, there's a bunch of stuff to talk about on this page, really. So peritoneum, again, double-walled membrane around everything. Whole abdominal cavity, over the abdominal organs, the digestive organs. But mesenteries are branches of that peritoneum that wrap around specific organs, kind of hold them in place. You can see that they're all holding them kind of against the posterior wall. You see that? Like all this is kind of attaching to this backside of the abdominal cavity. Posterior wall of the abdominal cavity is where most of these attach to, leaving the front a little bit more to play with. So this structure right here is this big loop on the front. It looks like a loop here. In the book, it's this picture. That one. That's what that big front loop is. This is called the greater omentum. It's down there towards the bottom of the page. It's in bolded though. It's a portion of the mesentery that forms like an apron. You know, like an apron that whatever the dad wears at the barbecue says best cook ever or kiss the cook or something stupid like that, right? Okay. All right, it's an apron. The mesentery, the greater mesentery is an apron of this connective tissue. It's a mesentery layer that folds over the whole front of our intestines, and it's a little bit thicker, and it's full of adipose tissue. Remember fat tissue? Why do you think we have this big layer, this apron over the front full of fat tissue? What is one of the things fat tissue does for us? Protection. So anywhere we have fat tissue is not just about storing energy. That is a lot of what fat tissue does. It stores energy in the form of glucose, but a lot of what it does is protection. So we have this layer of fat tissue that forms an apron over the front to kind of give us the benefit of the doubt. So our muscles and this greater omentum help us basically protect us from a gut punch, right? So that as human beings, we can kind of handle some impacts on the stomach and not just fall apart. You know, we can handle pretty tough impacts for the most part. And it's also full of blood vessels, so it definitely helps with absorption of nutrients. So it has a twofold role. But that's, I just highlight that. There is technically a lesser omentum, but I'm not going to focus on that. I'm just going to focus on that greater omentum here. Again, it's like 3 branches basically. You summarize the whole abdominal cavity is full of the peritoneum. But then I have mesenteries that are branches of the peritoneum that wrap around the organs individually. And then on the very anterior section of my abdominal cavity, I have this big apron fold of one of the mesenteries that's called the greater omentum, and it offers protection and blood vessels to capture nutrients and stuff like that. Because it's one of those things too where, again, I told you, our body is really good at not wasting stuff. So it's like, I've got this big apron in front, it's got a lot of protection. Why not have a bunch of blood vessels in there too, so that anything that gets missed in the intestines can also maybe get absorbed there too? Making sense, maybe, so far? Okay. This one won't, but we'll... If you look on 425 still, there's a fast fact at the top of the page, top right, sort of, or mid-right. It has 2 bolded words. It talks about intraperitoneal and retroperitoneal. Y'all see that on 425? Okay. So, basically what they're telling us, if I go back to this picture, what they're telling us these words mean, retroperitoneal and intraperitoneal. What are they talking about? So what they're talking about, okay, intraperitoneal, retroperitoneal. So it makes an example. Basically organs like the stomach or liver are enclosed in that mesentery, okay? So you can see that they are enclosed from these branches of the mesentery. The liver, all of them are enclosed, okay? They're intraperitoneal. They're like they're enclosed by the mesentery. They are within the peritoneal cavity, basically. They're in the abdominal cavity, they're in the peritoneal cavity. So, what you don't get a great picture of here is stuff that doesn't fit inside the peritoneum. So that would be anything that lies against this back wall and is not enclosed. So, it's not pictured here, but parts of our pancreas, that's not pictured here. Parts of other things that are technically in our abdominal cavity, they only get a layer of mesentery on the front, but they're not fully wrapped around the peritoneum. So their backside makes up the back wall of the abdominal cavity. And so there's a few in there. Technically also what's not pictured here, kidneys. I can't really draw a kidney very well apparently. Kidneys are kind of here, but they are in the abdominal cavity, but kidneys just rest against the back wall of it. And so the front, the anterior of your kidneys are only part that gets part of this mesentery, gets part of the peritoneum. So they technically call like the kidneys and part of the pancreas and all that, they call that retroperitoneal. Things like most of your intestines, your stomach, your liver, all fall in the category of intraperitoneal. Why do I make that point? So that's a little bit complicated. Why do I make that point? There's some imaging they do in stomachs, especially one, that when they're looking at the kidneys, they call it a retroperitoneal ultrasound. Retroperitoneal ultrasound. That's an ultrasound dedicated to looking at retrograde, behind the peritoneum basically, on the back wall of the abdominal cavity. So that's the only reason I make that point is because sometimes that imaging is used. And a general concept of what's inside the peritoneum and what's retro outside the peritoneum helps. But mainly it's the kidneys and part of the pancreas they talk about being retroperitoneal. Most everything else in the digestive system is going to be intraperitoneal. So inside the peritoneum. But again, it's all inside the abdominal cavity. Okay? It's just saying that back wall of our abdominal cavity doesn't get the layer of peritoneum like you'd expect it to. Okay? And still on that page, there's a lot of fun stuff on this page. I told you one chapter, but content not sparse. There's another bolded word at the fast fact at the bottom of 425 called ascites. Okay? Ascites. See that word, ascites? All right, so if I am something like a right-sided heart failure patient. Remember, they have fluid backing up into their system, right? System-wide. Sometimes it's a very common system for someone that has heart failure on the right side. They have fluid buildup in other places. Sometimes fluid builds up in the peritoneum, which is a double wall layer. Well, if it builds up in the peritoneum, sometimes it causes them to be, gravity flows to the stomach and down, right? Gravity's going to, so fluid now fills up this space. That's called ascites. Is it ACI or ASCI? I always forget. ASCIT, yeah, that's what I thought. ASCI. Ascites means fluid buildup in the peritoneum, basically, in the peritoneal cavity, meaning between the two layers of the peritoneum. A very common symptom with liver failure patients, but that's a little bit more complicated why that happens. But you guys should know the heart failure stuff, and so that's a common symptom with heart failure, ascites. So if you hear ascites, the term is just talking about fluid buildup in the peritoneal cavity, in the space between the peritoneum, filling up and going to cause a lot of fluid buildup. And they have to drain that usually because, again, it's going to cause them bloating here, but it's also going to cause pressure and pushing down on their abdominal organs, which would be like everything in our digestive system, which is not good either. So, again, that page is just full of words that are just really, really nice to know, but I'm testing you over, so they need to know. Mainly, at least you can get peritoneum and mesenteries down and be in all right shape. Okay, page 426. Oh, wait, question. I don't know. What is this one? Oh, yeah. The layer of the digestive tract that contracts and relaxes to propel food forward. There's only one layer you could think of that would do any contracting and any relaxing, probably. I hear two. That should give it away. Muscularis sounds like muscle or muscular. That should give it away that that's the muscular layer. So that's what it does. The muscularis is about basically contracting, relaxing to help propel food. That's why we have muscular layers in our digestive tract. Bonus points. Let's see if you can do this. What's the innermost layer? See if you're listening. Innermost layer, what's that called? That's mucosa. Okay, what's the next layer if I'm going from mucosa out? Submucosa. Then it's muscularis. Then the last layer on the outside, serosa. All right. You have that down just like other stuff, you're going to be in good shape. Okay, the mouth. The mouth and teeth I won't spend too much time on because I'm not a dentist. If you want to get into dental hygiene, they're right next door, all right? Miss Lexi and them are great at that. So I'm not going to spend too much time on it. We'll just say some stuff. One big thing is what starts in the mouth? Chewing, which is what? Digestion. That's my main point. If I asked you where digestion starts, I'm looking for the mouth as the answer, okay? So if I asked you where digestion starts, it's always going to be in the mouth. I mean, theoretically, I guess unless you can't chew food, then that's a different conversation. Talking about normal anatomy-wise, right? So the mouth is the entryway to the digestive tract. It's also where digestion begins. That's how they summarize it. And it's all about starting the digestive process by breaking down food. Only thing I'll probably highlight from the mouth is really this. So people, I just think it's a nice to know, but I'd say it's a need to know for my test because I just think people should know what this is called. This little dangly thing in the back of your throat, that's what everyone calls it, right? The dangly thing in the back of your throat. That's called a uvula. Uvula. And it does technically have a purpose. It does technically have a purpose, okay? So if you notice, the uvula is supposed to kind of fold backwards, posterior, fold backwards and like downwards, like I can't really draw it from this angle, but like that way. All the uvula is really supposed to do is help guide your food down and kind of prevent food from going back up. Because if it goes up, now it's going through it's going towards your nasal cavity, right? Because the nasal cavity pretty much ends right behind your palate, which is what they call the hard palate and the soft palate, the roof of your mouth and towards the back of your throat. So your uvula's job is just to help guide food where it's supposed to go. Keep it from going up your nose. That's all the uvula does. So again, a minor role in the whole, but I always just think it is, if you took anatomy and you're a nurse, you might forget some stuff, but generally some stuff you're like, oh, They're talking the dangly thing in the back of my throat. Everything I do with patients is country accent. It shouldn't be. It's kind of, but that's, again, I spent 8 years at a community hospital in Springfield, Tennessee. So, yeah, country accent is what I hear when I hear patients. So, because that's who I took care of for a long time. God bless them, as they say, right? God bless you. Oh, bless you, honey. All right, right? Anyway, so it's not I am country. That is me, too. I can just turn it off and on somewhat, but some people in Springfield cannot do that. They can't turn that off. That's part of their DNA, as they would say. Right? But anyway, so they say the dangly thing in the back of my throat, you say, well, that's your uvula. It kind of helps prevent food from going down if you didn't know. And then you'll teach them something. You'll learn that nursing's a lot about teaching. If you don't like teaching, nursing's got a lot of that. You're doing a lot of teaching layman's, people, not people that are literate. I'm just saying people that layman's means people that just don't know medical. I'm the only medical professional in my family. I get a lot of phone calls because of it. But I'm the only medical professional in my family. So that means that when I talk to family members about stuff going on, my goal is to teach them, to help them walk through it and feel more comfortable. So I just think that anatomy should be a basis of learning some things that are practical that might come up in the real world. That's all. That's all the anatomy structures I'm going to highlight from the mouth right there. That's it, the uvula. Everything else we talked about before. The tongue, we all know we have teeth. The palate's the roof of your mouth, if you didn't know that. But there's not a lot of stuff I think is pretty self-explanatory. So bottom of page 426, I will mention a few things about our salivary glands, which is named for what produces saliva, right? Okay. Saliva is important. It's a mostly clear fluid, but it contains some mucus, and it contains enzymes that help break down food, and it contains enzymes that help kill bacteria. So overall, saliva is pretty important in the whole path of digestion because, right, remember that our mouth, we have our tonsils all lining our mouth and nasal cavity, right? Because this is the entry point for air and food and entry point for everything. So if we're going to get a bacteria on a food or bacteria from somewhere, it's probably going to first hit the mouth. And so it makes sense to have a saliva that can kill bacteria. And then there's always this conversation too about like dogs or somebody has better mouths than humans or cleaner mouths. And I was like, it depends on what the dog's eating. If the dog likes eating cat poop, then that would be a no. The dog does not have a cleaner mouth. What they say that, have you ever heard that before? They say that from dogs have more enzymes than we do to kill stuff. Basically because nature knew that dogs would probably eat cat poop. So let's give them better enzymes to kill off stuff. That's all, really. I wouldn't say their mouth is cleaner. If you don't like dogs licking people in the mouth, don't watch Deadpool and Wolverine. I'll tell you that much. That's my only hint. That's the only spoiler for that movie. I love Deadpool, but anyway, just as a side note, why are we bringing 3-year-olds to Deadpool? I just want to know. Why? What screw is loose in people? I just want to know. It's not. It's an adult superhero movie. It's rated R for God's. Anyway. Whew, okay. And the baby screamed the whole time. I just want to go over there and choke somebody. I paid $30 to listen to your kid scream. You got your 5-year-old and your 7-year-old here. Are you on crack? What's wrong with you? Okay? Do not bring kids to R-rated films. Don't be that person. You're a terrible person. Same person probably smokes in the van on the way home. Calling shots out. All right? Don't be that person. Don't be that person. So frustrating. And for the kids, too, okay? Like, the kids don't need to be there. Kids are innocent. Let their innocence be intact as long as possible. Anyway, yeah, I would recommend the movie, but if you don't like profanity, I mean, if you've seen Deadpool, you know what you're getting into. Holy crap, the profanity. I'll say that. Holy crap. It's out the wazoo. All right. So salivary glands, the only thing I'll highlight, there's a bunch of salivary glands, but we'll say this. We'll highlight one. That big one. It's called the parotid gland right here. It's a huge one, parotid gland. This is our main salivary gland. It's one of the largest ones we have. It's on either cheek or inside either cheek. The only reason I'm highlighting that one is because it is our biggest salivary gland. And the book makes a point there that I think is interesting. Because when you start learning about diseases, this might help you a little bit. There's something we get. Most of you have had vaccine series called MMR. That stands for measles, mumps, and rubella. Mumps is a disease. You probably don't even know what mumps is because we've had a vaccine for it for so long that there's very few cases of mumps until lately. Measles and mumps have made recurrence because people stopped vaccinating people because, you know, the government's trying to kill them or whatever. Nonsense. I'm just saying this. There's a reason we don't have polio. There's a reason we don't see measles and mumps that often. It's called vaccines. You should get them. So they're pretty newfangled vaccines. So anyway, that's where I stand on that. Not scared. Huh? Yes.
You said that was the largest.
Yeah, it's the largest.
The largest what?
Salivary gland, saliva gland. Saliva gland, or salivary gland is how you say it. So that's just the largest one we have. And it's weird, I'm talking about the mumps virus. The mumps virus specifically, for some reason, targets the parotid glands. So if I get mumps, people get swollen parotid glands. So mumps equals targeting this gland, swelling, inflammation, that sort of stuff, which is interesting. Some viruses, like mono and some other ones, can target the parotid gland as well. Why that is a little bit of a mystery, but that's just one of the things. So I'm putting that as kind of like an asterisk need to know for me, because when they start talking about some vaccines and stuff and they start talking about symptoms of measles, because when you learn about vaccines, they're going to try and teach you, like, what do these diseases look like? So I'm not going to force you to learn measles and mumps and rubella right now, but let's just say for mumps as a disease, for some reason it causes inflammation and swelling of the parotid gland. So, yes. No, well, mono can, but I wouldn't stress about that. The book talks about mumps, so I'm going to stick with what's in the book. The book doesn't talk about mono. Mono can cause some weird lymph node swelling. It can cause parotid gland weirdness. It's a weird one. You know, the kissing disease. Yeah. That one. What time is it? Let's see. 9:50. If we took 10 minutes or so, we could have 30 minutes left. Or keep going. I mean, we can keep going. Huh? All right, whatever. Let's keep going. I didn't say that. Sure. All right. So teeth is going to be really short and sweet. I'm not really going to give you much about teeth. Again, not a dentist, so I'm not going to worry too much about it. I will say anatomy-wise, I feel like it's worth saying this. The adult mouth contains 32 permanent teeth. That's what we're supposed to have. So again, I was more of a joke about me working in the country for a long time. But also, most of us have had our wisdom teeth out, right? Categorically, we are supposed to have our wisdom teeth. Now, there's all this debate about were we supposed to not have them. It doesn't really matter. Wisdom teeth count. So wisdom teeth count as, those are your third molars. So basically, that's 4 teeth. A third molar on the bottom times 2, third molar on top times 2, so 4 teeth. A lot of us had our wisdom teeth out, so we're minus the 4 teeth. So for me, I'm actually minus 6 teeth anyway. My mouth is really small. I blame my mom. Okay, frail body, that's what it is. Really small mouth, so I don't have as many teeth. I have like 20, whatever that is, 26. But we're supposed to have 32. So, yep. So the wisdom teeth are supposed to be there. If they don't ever grow in, they don't ever grow in, but they count. So 32 teeth. So that's the adult. If I have baby teeth, you remember baby teeth, right? The teeth we get as a child, they fall out. Those have a name on the right-hand side. They're called deciduous teeth. Deciduous teeth. Those are known as baby teeth. So theoretically, you should get a full set in your mouth of 20 deciduous teeth, and then they should start falling out and being replaced as your mouth grows with the permanent adult teeth. So 20 is the top number for deciduous teeth. 32 would be the normal adult teeth that we're supposed to have. Again, a lot of us jokingly don't have 32 teeth because a lot of us have had our wisdom teeth out. Other than that, I'm not going to talk about too much with the tooth anatomy. I left the slide in here, but just so you can kind of look at a tooth in general. But Teeth have decent amount of blood flow. Teeth all have a dedicated nerves to them. If you ever had a root canal, you kind of know what that's about. I've had a few of those. My teeth are terrible. They're falling apart. I should just get dentures and move on. I'll be fine with it. I don't care anymore. At this point, as much money as I spend on teeth, they'd probably be cheaper. So, but, what do I want to say? It's made the point to say this, is that what the tooth is covered in is called enamel. So this white stuff, this is the enamel. That's not a bad thing to know, but that's all highlights. So the number of teeth we have is supposed to be 32 as an adult. Deciduous teeth is a name for baby teeth. We're supposed to have a full set of 20 of those before they start to fall out, theoretically. That's not always perfect. And enamel is an interesting substance that covers our teeth, and it's actually, enamel's the hardest substance in the body. It's harder than bones. So our teeth are mostly made of a bone material, but what the outside is called enamel. It's a substance that's very similar to bone, but it's actually stronger and tougher than bone. It's the toughest substance we have in the body, which makes sense because your teeth are supposed to kind of take pounding and chewing up stuff forever, okay? And so poor diet, bad oral hygiene, all equals to tooth decay and cavities. Those are called caries. But overall, our teeth are supposed to be very, very strong. They're supposed to last us our lifetime, but they don't always. That's all I'll say with teeth. I don't think there's too much else to know. Oh, let me go back, actually. Sorry, I messed up. I did mess up. So I got distracted on the Deadpool talk, but saliva. The body of work talks about saliva. Next to it, the salivary gland section. So we talked about the parotid gland, but again, what is saliva? Saliva helps to break down food chemically, and it also helps to moisten food in the mouth in general. Because if you ever try to eat a bunch of crackers, what happens? Like just saltines, right? You try to talk, what happens? Right? It dries your mouth out, doesn't it? Yeah. And you're like, I need water, right? So our saliva has a huge role in kind of keeping our food moist and helping us swallow it more easily, right? Because anything dry, if you try to swallow it, makes you cough like that, right there. Thanks for showing us, Panthea. I knew that's not what you're doing. I'm sorry. Excuse you if that was a sneeze or something. But yes, right, if that was, we're trying to swallow. So saliva moistens, but it also helps with like disinfectant, antibacterial, and it also breaks food down. So that is a process of enzymes that are in the mouth. So this is where we start the enzyme discussion. Enzyme discussion starts now, and it kind of continues. So everything we talk about is going to have enzymes associated with it that break down one of those three components: protein, fat, sugars. And we're going to want to kind of keep up with that. If you look at the end of your book, the end of the chapter, there's a chart on all the enzymes, and we will talk about that, but you're going to want to kind of keep up with what enzyme does what. And some of them are secreted by the same organ. One of these enzymes we're just about to talk about with the mouth, and that's in our saliva, is actually secreted also by the pancreas. So it doubles up. But it's called amylase, and there's also lipase. So all of these have a specific thing they break down. Amylase breaks down starch, which, does anyone know what starch is? That's a type of sugar. Lipase breaks down or helps with the digestion of fat, helps to start that process. So our saliva contains amylase and lipase. And its goal is to start breaking down those things with those enzymes and to moisten our food and help us slide down the throat, basically. Because I always think of that as saliva is useful, because if I try to swallow some saltines, it's dry, it's hard to do. I need saliva. I need liquid. So I backtracked there. Sorry about that. So that's our teeth, our saliva, and our mouth. So which enzyme acts in the mouth to begin the breakdown of starch? We just said it. Which one breaks down starch? That's amylase. Amylase breaks down starch. The rest of these we haven't even talked about yet. Amylase is starch. What was the other one? I forgot already. I'm just kidding. Lipase. So lipase is kind of spelled, looks like lipid, which is fat. So if you hear lipase, It's kind of in the name. Lipid is Lipid, so like a lipid. Lipase is spelled like this. You're going to see a theme with enzymes that break food down. What's the theme you see already? That ACE ending. So pretty much if you see something ACE, it's usually going to be talking about the enzyme that breaks down that component. So lipase, enzyme that breaks down lipids. Amylase, I don't know where they get the AMI from, but amylase is ACE, it breaks down, okay, sugar. So you'll see a theme there with these enzymes as we go. But amylase breaks down starch, which is sugar. So the next structure, so basically we talked about the structure so far of our, as far as our digestive tract structures, has just been the mouth in general, where food is touched and there's some breakdown, digestion starting. That's been the mouth. So right now, really, if you kind of look back and think about how the book broke it down at the first, it broke it down into digestive tract, meaning kind of the structures where food passes and some digestion's beginning, versus accessory structures, which are just assisting along the way. And so really at this point, we've just talked about the mouth in general. Now we're in the pharynx, which is really the second structure of the digestive tract, which is also the pharynx is shared with another type of system. What other system? We just learned it. Respiratory system. So all the pharynx is your back of your throat, basically. And remember, the pharynx is shared with the respiratory. So if I asked you this, if I said, hey, which structure that we learned about is in two different body systems or organ systems? The answer would be pharynx. So which structure that's in the digestive system is also shared with another organ system? That answers the pharynx. Does that make sense? I'm saying there? Maybe? Yeah. Okay. The question was, if I said, hey, there's a structure that's in our digestive system that's also in the respiratory system, what's the answer? Pharynx. Okay? And we have a few of those. Because we're going to talk about this chapter, we're going to talk about the pancreas. Pancreas is super important for digestion, but what else is the pancreas super important for? Does anyone remember? Huh? That's insulin. So the endocrine system, right? Right. So the pancreas is a huge role in the endocrine system and the digestive system. So there are going to be overlaps, right? So the pharynx is all its job is again, I just look at the pharynx as the back of my throat or the start of my throat. And all the pharynx job is for food to pass down safely. So I chew it up. What the book makes the point of secondarily is calling food this. It calls it a bolus of food. I don't know if anyone's ever heard this, but a bolus. That's what they call this food as it's clumped up. I made that point a little bit with saliva, but what they're saying is when I'm eating food, right? A food bolus is saying that I've already chewed this food up. It's mashed up. Saliva has started to digest it and has made it nice and like goopy, something to swallow, right? If you have little kids, right, if they chew something up and then like, I don't like it, and they spit it out, my babies do this, they put it in your hand, you're like, it doesn't even really resemble food anymore though, does it? It's just like goop, and you're like, whatever. That's what a food bolus is. It's a lumped up mass of the food you just chewed and swallowed, right? That's a food bolus. And so there's actually a diagnosis, like there's a diagnosis code. I used to do some building and coding. There's a diagnosis code for food bolus, meaning that food is lodged in the esophagus. And this happens typically in elderly patients, but this can't happen if food gets lodged somewhere. They actually diagnose that and call that a food bolus. There's a medicine that helps open up the esophagus they can give to try and dilate it and get the food to pass into the stomach, but anyway, if not, they'd have to go in and fix it surgically because you can't have your esophagus blocked up. Eventually, most stuff will pass, but they actually call it a food bowl. So that's where that name comes from. It's just, you can't really refer to that as food anymore is my point, right? It doesn't resemble the hot dog you ate or the hamburger. It looks like just, I don't know what, gunk, right? You're like, what is this? So that's why they call it a food bolus. It's a bolus mass of food that's been broken down somewhat and lumped together with saliva. So Moistened would be the word, which I know most people hate the word moist, but like a trigger word for people. Moist, whatever. Moisten. Food bolus. Now the food bolus travels past the uvula that kind of helps direct it. I swallow it. It moves into the pharynx. And when I'm in the pharynx, okay, right, remember the structure from the larynx, the epiglottis, right here at the top of the larynx? That swallowing effort tells the epiglottis that, hey, fold over. It folds down and over, blocking entry into the trachea and making sure this food bolus goes posterior. It goes to the back side of my neck, so I hit the esophagus, the neck structure. The esophagus is my food tube. That's where I want food and water to go. So we've learned about the epiglottis and the respiratory system. You can kind of see where this all plays into it. Again, the pharynx is everything before the epiglottis. Technically, the epiglottis is still part of the larynx, so there's not anything new there. We just don't want any part of food to go anywhere near the larynx. We want it to slide past it. We want it in the esophagus, okay? Does that make sense to people, right? Yes. Okay. So the esophagus, easy peasy. It's at the bottom of 428. Not much to say here. The esophagus is a long muscular tube that attaches from the pharynx, the back of the throat, to your stomach. That's all the esophagus' main job is. Your esophagus is a 10-inch or so tube that connects your pharynx to your stomach. That's all its role is. The book just calls it a muscular tube about 10 inches long or 25 centimeters. So we swallow, it makes it past all that point, our epiglottis works right, all those things happen right, and now our food's in our esophagus where we want it. It is on its way down to the stomach. And you can see that this is all kind of designed too with gravity. Now the esophagus has those same layers we talked about. Remember muscularis? It's the same layers. So it has some muscle to help propel food down, but gravity helps a lot. So gravity is a huge role in this, straight kind of down into the stomach. So the only thing I'll highlight from this is a couple things it discusses. One is they have a name for this right here. So this word we haven't talked too much about, but they also call this the LES. But this word, sphincter, is such a kind of funny word, but it's really a word that's used a lot, especially in the digestive tract. All a sphincter is just a ring of smooth muscle, okay? All a sphincter is a ring of smooth muscle. And sphincters in our body's only job really is to kind of control the movement of things, basically. So we'll talk about some sphincters we have lower that have a lot to do with us being able to go to the bathroom, but that's all a sphincter is. If you hear a sphincter, it's talking about a ring, like a muscular ring of smooth muscle. So there's a sphincter that helps kind of control the entry of that food into the stomach, and it's called the lower esophageal sphincter, or LES. LES, lower esophageal sphincter. So the other thing it talks about is heartburn. Who suffer from heartburn, indigestion? Probably most people in this room. I have got to take a med daily. I'm falling apart, people. I've been taking that for years, though. I've had heartburn for probably 10 years. Probably about the time I started nursing school. Huh, that's interesting. There's a lot of things I had. I didn't have psoriasis before I started nursing school. I'm just saying. Anywho, so heartburn or indigestion typically is, guess what's in our stomach? We all kind of know this. We haven't talked about the stomach yet, but what's in there? That would burn. Acid. Our stomach is full of stomach acid that we're going to talk about with the stomach, but it's acid. It's acidic. So acid burns, acid breaks down things. Well, think about this. This is why they tell you not to eat a big meal and then lay down, because a lot of the esophagus works with gravity. And this LES works with gravity. So the lower esophageal sphincter's job is to kind of open up, let food go through, and then close back and kind of hopefully prevent food from backflowing. Because the tissue in our stomach is designed to handle that acidity, but the esophagus mucosa is not really designed to handle acid. And so if I eat too much, I get heartburn and indigestion because some of that stuff is backflowing and not making its way through the sphincter properly, or backflowing through the LES and burning the lining of my esophagus. So if you ever had really, really bad heartburn, it usually hurts right mid-sternal, like in there, right mid-sternal, or not said right, but in the middle, mid-sternal, and it feels like burning, sharp pain. It's because you're burning the mucosa of your esophagus with the stomach acid backflow. And so this is my, watch out for it on Thanksgiving. This is my Thanksgiving time for sure, when you eat too much, okay, right? But that's what the LES's job is to allow stuff in, and hopefully it's a sphincter that's going to close and prevent stuff from backflowing back out. But if I lay down or I eat a big meal or I eat very acidic meal, then I can make myself more at risk for it. And again, this is where you don't want stomach acid burning your esophagus. This mucosa is not designed to handle it. It causes that pain. It could also cause ulcers. Ulcers are, we'll talk about here in a little bit, but ulcers are eating away the lining of your the eroding the lining by acid or other means, and that's a bad deal. Because then, remember, the mucosa, the mucus is there to protect us. If I burn through the mucosa, what's underneath the mucosa? Submucosa, which I said contains what? Blood vessels, nerves, right? All that stuff. So if I burn past that, I'm going to get into bleeding, and it's all bad news. So as soon as food hits the esophagus, triggers a wave-like motion from those muscles, and it's getting into the stomach. All right, I suppose we'll end with the stomach. That'll be a good place to stop because there's a lot of stuff here. So we can get it done in 10 minutes, though. Huh? No. I mean, we'll do the stomach and then stop. Yeah, sorry. I said, we'll do the stomach. It should take 10 minutes. I was kind of talking to myself, honestly. I was trying to think through it. Yeah, sorry. That happens a lot. Yeah. Specifically, okay, so the stomach's job, that has some anatomy structures based on its curvature, the way it looks. So all of our stomachs look very the same. They have this like curve to them, this S curve, so to speak, kind of curves this way. So there's some areas. So stay with me here, but they label them for you. So there's an area right here where the LES is. They actually call the cardia. Now why? I think it has something to do with its location to the heart. They call this area the cardia. So let me just throw this out there as a very, very, pay attention to what I'm saying because you're going to get confused if you don't. This first area where the LES is, where food enters, is called the cardia. So you might hear someone, and the book even says that sometimes the LES is called the cardiac sphincter. Not because it's near the heart, but because this area is called cardia. I'm never going to use cardiac sphincter. I'm always going to use LES, but I want you to hear that. That's where that word comes from. They call the LES the cardiac sphincter sometimes because that area where the LES enters the stomach is called the cardia, okay? So when the food first passes the LES, it's now in the cardia before it dumps into the rest of the stomach. Now, why they call it the cardia, I cannot help you there. I don't know. But I never use a cardiac sphincter. I use LES, so I don't confuse you. I'm never going to use the term cardiac. I'm going to use lower esophageal sphincter, which means I know where my esophagus is, right? Lower esophageal is telling me to look my eyes to the end of the esophagus. Does that make sense? Do you understand what I'm saying, right? Not going to use cardiac sphincter, but I want you to hear it if someone calls it that. That's why they get that name. That area is called the cardia. So there's an area up top, kind of the upper portion of the stomach, called the fundus. The fundus. Some of you might have heard of fundus used another place. There's another fundus in our body. Well, and 50% of our bodies. Huh? Yes. Anyway, fundus is I figure some people might know, but the fundus is talking about the uterus. Anybody's had a baby. If you've had a baby vaginally, they'll come push on your fundus. They're pushing on the top portion of your uterus. If anyone's had a baby where they come in, they push on your stomach like that, that's what they're pushing on. It's called the fundus too, so don't get that confused. Fundus is the upper portion of the stomach. It also has a name for that. There's actually a procedure called, if you want to get all technical, called a Nissen fundoplication, which is real fun. But they actually do a procedure where they take this fundus and they stretch it around the esophagus and make a stronger sphincter. it's a treatment for severe regurgitation, indigestion, heartburn, bad LES. I was working with one of the doctors, was like the first one to do it out of Nashville, laparoscopically anyway. They've been doing it for a while, but laparoscopically. So, and then the body is just the whole thing, pretty much the rest of it. The rest of this thing is called the body of the stomach. So cardia is right where the LES is. Fundus is up top. Body is the whole body of the stomach. And then the last little section on the way out of the stomach is called the pylorus. Pylorus, which is this section here, pylorus. And it has another sphincter leaving the stomach, which makes sense, right? Sphincter is just a ring of smooth muscle that kind of helps control the flow. So we have what's called the pyloric sphincter because it's in the area of the pylorus. You see that? That's kind of why they called it the cardia. I wish they just changed that name of the area of the stomach, but that's why they call that LES. They call it the cardiac sphincter because it's in that area. But I like LES better. I think it gives you a better insight of what we're talking about. So the two sphincters we have entering the stomach is at the end of the esophagus called the LES, and then leaving the pylorus area of the stomach is the pyloric sphincter. And so the sphincters those muscles don't get engaged unless they feel the presence of food kind of pushing against them. That's all the anatomy with the stomach. So the pyloric sphincter or the pylorus? It's just this part of the stomach. I mean, it's just this. It's just that part. No, don't worry about the curvatures. Just generally the stomach, everyone's stomach has this same shape. It's all curving kind of to the left, basically. The only reason it matters a little bit, you know, somewhat of these is because we have procedures where they called gastric bypass. Have anyone heard of gastric bypass surgery? Probably a lot of you have. A lot of gastric bypass surgery is manipulating the stomach to make it smaller. That causes people to lose weight, and it also causes people to be able to eat less. So that's a whole rabbit trail I'm not going to go into, but you will talk about gastric bypass surgery, different types. There's different like Roux-en-Y, and there's 3 or 4 different types of gastric bypasses. And at some point in the nursing program, you'll talk about those. So once we leave that pyloric sphincter, we've left that little pylorus area of the stomach, we're into the small intestine, so we'll talk about that Wednesday. But taking back to the stomach, the role of the stomach is basically twofold. That's really it, okay? I want you to make something very clear. I know it's at the end, and I said we'll end early, and we will, but listen, this is very important, okay? We talked about digestion, right? Digestion is just breaking down food. The stomach is all about digestion. There is no absorption of nutrients. So the other word that comes up when we start talking about the small intestines is the word absorption, right? I think about it for a second. Absorption means I'm taking those nutrients that I broke down, I'm taking them into the bloodstream and distributing them somewhere. That's what absorption is. There is no absorption that happens in the stomach, okay? Your stomach is all about digestion. It does not absorb nutrients, okay? Do you hear me there? Yeah. All right. We're going to talk about absorption, but we're still just digesting the food, which means we are only still just breaking it down, trying to break it down. The goal so far of the digestive system has been from the mouth to here is breaking it down. So how does the stomach do the breakdown? It's no absorption. So again, no absorption in the stomach. Only digestion. How is it doing that? Twofold. It's full of hydrochloric acid. It's full of acid, okay? And the book makes a point about that the stomach is still partially digesting things at the body of work about the stomach, but it makes the point that this takes place in the intestine. So going back to overall, the overall goal of the stomach is just, I'm going to break down food. So the goal is still digestion, which means breaking down food. How does it accomplish that? It accomplishes that with hydrochloric acid, okay? I'm not even spelling that right. Don't care. Don't care anymore. churning. I don't know how you spell churning. I'm guessing like that. Churning? I guess that would be. That's the way to accomplish digestion. The acid is going to break down stuff more. That's all I would summarize for the stomach. That acid is going to break stuff down. If you ever seen like a cartoon or a movie or something and talk about a vat of acid or whatever, acid is just going to melt away material, okay? And so hydrochloric acid is one of the most acidic things in the world. There are some stuff that's more acidic found in nature, but we have some of the strongest acid just in our stomach. And its goal is to take whatever dumps into there and break it down even further, okay? And then the other goal of it again, or the other role of it is that the stomach, what they're showing us on this picture right here, it's on the bottom of page 429. You don't have to know any parts of this. All they're saying here is that they're telling you that the muscularis, look at this. They're telling you that the muscularis has multiple muscle layers. Multiple. You don't have to know that necessarily. You don't have to know the names of any of this from that picture. All I'm saying is that the stomach has another extra layer of muscle than the rest of our digestive system. It still has the same, mucosa, still has all the same stuff. It has a thicker mucosa and one more muscle layer to make it stronger because it wants to. Why do you think it has a thicker mucosa? The acid, right? That makes perfect sense that it would. It has more muscle because all the stomach's job is to churn and move and kind of keep, so it mixes all the stuff with acid and it breaks it down further. That's your stomach's role, okay? So all the stuff like rugae and other stuff, you don't necessarily have to know the names of those muscles. You don't have to know all this stuff. It's just that goal. What's the goal of the stomach? Digestion. How does it do it? Acid plus spinning it all around, right? How do you mix something up? Mix a drink, you shake it around, right? That's what it's doing, okay? So page 430 and 431 talk about a bunch of stuff with gastric pits. And they talk about the enzymes released. I think that gets a little bit into the weeds. It's this picture here. That's a lot into the weeds. So I'm not going to stress you out about the different cells in the gastric pits and that sort of stuff. I will say this. Don't have test questions directly over it, but let me say this, okay? There are some medications that you take maybe to help prevent stomach acid. Not so much Tums, but things like omeprazole, which is Prilosec, things like Nexium. You guys heard of those? So some of those guys work by messing with some of these cells because these cells, you can see mucus cells. What do they produce? Mucus. Parietal cells secrete the acid. We have other cells that secrete digestive enzymes. So I'll make that point is that we do have a digestive enzyme that's specific to the stomach called pepsin. P-E-P-S-I-N, pepsin. It's called pepsinogen there. You'll see later it talks about pepsin. So the rest of the cells I wouldn't stress you out too much about, but I will say that, again, some medications specifically mess with these cells, and you may be asked to understand the mechanism of action of some of those medications, okay? So I'm not going to test you over mucus, parietal cells, or chief cells, but just know they're out there. So if you hear about omeprazole or something targets this cell in the gastric pit, don't be like, what the heck is that? You know what I mean? Like, have a general understanding of it. We're talking about the stomach, and you can refresh yourself a little bit more. And the only other big thing I know we're trying to get here early is to finish the stomach conversation is peptic ulcers. Has anyone ever heard of an ulcer? Yeah. So again, I mentioned what an ulcer was. An ulcer is a sore, like a crater-like sore where the the mucosa maybe has been eaten away. It's the lining of the stomach or maybe the lining of the esophagus eaten away. If it's a lining of the stomach that has an ulcer, that's called a peptic ulcer. And they can erode through the wall. If it erodes through the wall of my stomach, well, that would be bad, wouldn't it? Because what would happen, you think? If I have a hole in my stomach, what's now leaking into my abdominal cavity? Acid, right? This really strong hydrochloric acid, right? And the other organs aren't designed to withstand that. That's a bad news, right? You ever seen Alien? You know, where alien dies and drops acid, it goes through the whole ship? No? Okay, well, anyway. That'd be the problem I'm saying. All right, Alien Romulus comes out soon. Super pumped. I'm going to have to see it alone. So if anyone wants to go see Alien Romulus, come with me, I guess. I don't know. Huge Alien fan. Sigourney Weaver for life. All right. The only other thing, peptic ulcers. Yep. It's on peptic ulcers still. The point with peptic ulcers was a bacterium is usually the cause. Helicobacter pylori. I can just tell you to read it then, if that's what you want. Read it then. Peptic ulcers is something you should know what's causing them. The main causes usually is going to be, they usually indicate Helicobacter pylori, a bacterium causes them a lot of times. And that's why that's where they get the name sometimes pyloric ulcers or something like that. Helicobacter pylori is a bacterium that's found in the stomach that sometimes it'll infect those gastric pits, cause an infection in the gastric pits, then that causes ulceration because the acid gets down there and all kinds of problems. And there's some drugs that interfere with it, but just read the peptic ulcer thing. And that's the phases of digestion, cephalic, gastric, don't worry about those, that sort of stuff. That should be everything with the stomach.